Hey everyone, and welcome to The Explainer. Today, we're setting the stage for a really fascinating journey through the bizarre, varying, and honestly, sometimes downright shocking pathology of the human body's vascular system. We're going to look at the exact same bodily infrastructure and see how it can produce wildly different outcomes. We'll guide you through this incredibly complex spectrum so every single concept is super easy to grasp.
Okay, let's dive into this, because this right here is the central mystery we're unraveling today. What on earth could possibly link a completely harmless familiar strawberry birthmark on a baby's skin to severe exposure to industrial plastics? Well, the answer is the human vascular system. Both of these anomalies, the familiar harmless birthmarks and the incredibly severe life-threatening cancers, share the exact same origin network. It's literally a classic Dr. Jekyll and Mr. Hyde scenario, and it's happening right inside our own biology.
Section 1. Decoding vascular tumors. Before we can really explore those extreme ends of the spectrum, we just need to get a handle on the fundamental building blocks.
So, vascular tumors are defined, quite simply, as tumors originating in the blood vessels and lymphatics. I want you to just think about that for a second. These tumors are arising from the very pipelines that literally keep us alive. The blood vessels that carry oxygen and nutrients, and the lymphatics that manage our immune responses and fluid balance. These are the networks that can suddenly just start growing abnormally. And because these pipelines exist everywhere in the human body, the anomalies that spring from them can also show up just about anywhere.
Now, what's really interesting about this slide is how clearly our subject actually divides into two distinct extremes. On one side, we have the benign category. These are your non-cancerous growths, so things like hemangiomas, lymphangiomas, and glomangiomas. Then, on the totally opposite side, we have the malignant, cancerous category, angiosarcoma and Kaposi sarcoma. I should probably mention, just in passing, that medical science does recognize an intermediate stage between these two extremes, which is known as hemangioendothelioma. But for today, our primary focus is really going to be comparing that benign side with the dangerous malignant side. Section 2, benign, familiar, but vulnerable. Let's start our deep dive over on that benign side of the spectrum.
You know, the word tumor inherently sounds pretty scary, doesn't it? But when we're talking about the category of hemangiomas, we're often just talking about really common birthmarks. This includes classic strawberry birthmarks and port wine marks. You've almost certainly seen these on people in your daily life. They're most commonly found right on the surface, on the skin, in the subcutaneous tissue just beneath it, or in the mucous membranes of the mouth and lips. Far less commonly, they can develop deeper inside the body, in places like the liver, spleen, and kidneys. But here's that vulnerability I mentioned. Because these are basically tangled collections of blood vessels, they're particularly vulnerable to traumatized ulceration and bleeding if they happen to get bumped or injured. This brilliantly illustrates one specific type, the cavernous hemangioma. Just picture a red to blue, soft, kind of spongy mass. This specific formation usually pops up on the skin of the face and neck or inside the oral cavity, stomach, or small intestine. And that spongy texture? That's a direct result of dilated, cavern-like vascular spaces that are literally filled with blood. Building on our understanding of the benign category, let's look at lymphangiomas. Unlike the blood-filled hemangiomas we just talked about, these originate in the lymphatic system. A key takeaway here is that these are congenital lesions, which means they're present right from birth. They're classified into three primary structural types. You've got the capillary type, usually found in the skin of the head, neck, axilla, which is just the armpit area, and mucous membranes. Then there's the cavernous type, which also commonly occurs in the head, neck, and axilla. And finally, there's a cystic type.
Section 3. The painful nail bed anomaly. All right, we're going to shift gears now, moving away from anomalies that are mostly painless and visual to a visceral outlier. We're looking at a benign tumor where the physical location makes it incredibly specific and highly uncomfortable.
I want you to really just sit with the physical reality of these words for a second. Painful nodules under the nail. Just imagine that sharp, squeamish empathy of having a small, highly sensitive mass growing directly underneath your fingernail or your toenail, constantly pressed against the nail bed. Ouch, right?
Well, these highly sensitive masses are called glomangiomas, or glomus tumors. As you might suspect, they're pretty uncommon and thankfully entirely benign. They present as small, red-blue nodules that can be flat or just slightly elevated. And while they are famous for occurring right in the dermis of the fingers or toes directly under the nail, they can also occasionally be found in the stomach and the nasal cavity. But here is the really great news: to alleviate some of that squeamishness we just felt, despite how remarkably painful they sound, they're usually readily excised and cured. Basically, a simple surgical removal takes care of the whole problem.
Section 4. Malignant and dangerous invaders.
Okay, we are now crossing the threshold. We're leaving the benign, manageable anomalies behind us and pivoting our focus to the aggressive, malignant vascular tumors.
So the crucial point is really the sheer scope of this disease. Angiosarcoma is a malignant vascular tumor that occurs frequently across almost the entire body. We're talking the skin, subcutaneous tissue, liver, spleen, bone, lung, and retroperitoneal tissues. And even more concerning, the data shows it acts completely indiscriminately. It can occur in both sexes and literally at any age. It's a widespread and very dangerous invader of the vascular network.
But there's a highly specific subcategory here that honestly reads almost like a true crime medical mystery: hepatic or liver angiosarcomas. These are of special interest to pathologists because of their direct association with very specific man-made carcinogens. We're talking about exposure to polyvinyl chloride, a major chemical used in the plastic industry, exposure to arsenical pesticides, and exposure to thorotrast, which was actually a radioactive substance formerly used in medical radiography. It's just a terrifying and fascinating revelation that specific industrial chemicals and historic medical practices can directly hijack the liver's vascular network to trigger this kind of severe malignancy.
And that brings us to the final malignant tumor in our explainer, Kaposi's sarcoma. This is a malignant angiomatous tumor, but what makes it incredibly unique in the medical world is how it actually targets human populations. It manifests in 4 very distinct forms, and those forms are strictly dictated by the patient's demographics and their immune system status. As you can see, Kaposi's sarcoma operates along some incredibly specific demographic lines. First, we have the classic or European form, which usually affects elderly men. Second, there's the African form, which primarily affects Black young men and children. Third, we see the epidemic form, which specifically affects patients battling AIDS. And finally, the immunosuppressed form, which targets transplant patients whose immune systems have been artificially lowered so their bodies can accept new organs. It's a really stark look at how a single type of vascular malignancy finds distinct pathways depending entirely on who the patient is and the current state of their bodily defenses.
As we wrap up today's explainer, I want to leave you with this somewhat provocative thought. How does the exact same physiological network, these incredible pipelines that keep us alive, give us a completely harmless, familiar strawberry birthmark one day, but become hijacked by industrial plastics and immunosuppression to form aggressive cancers the next? The duality of the human vascular system is as incredibly robust as it is deeply, deeply vulnerable. I really hope this deep dive has helped map out that spectrum for you today. Thank you so much for joining me, and as always, keep on learning.